Cystic Fibrosis by Kyla and David.
Cystic fibrosis is a genetic disorder that not only affects the lungs, but the name cystic fibrosis also refers to the disease's effects on the pancreas, where it can lead to cysts, which are fluid-filled sacs wrapped in a membrane, and fibrosis, the excess buildup of connective tissue that can replace or infiltrate normal tissue organs.
CF is an autosomal recessive disorder involving the CFTR gene. It encodes the CFTR protein. CF develops when there's a mutation in a CFTR gene. But because it is autosomal recessive, you need to inherit two mutated CFTR genes, one from mom and one from dad. Now, if mom and dad both have a copy of the mutated gene and one normal gene, they're considered carriers, and they don't have the disease.
The CFTR protein is a channel protein that pumps chloride ions into various secretions. Those chloride ions help draw water into the secretions, which end up thinning them out. This CFTR protein with a delta F508 mutation gets misfolded, meaning there's a lack of CFTR protein on the epithelial surface. This then means that it can't pump chloride ions out, water doesn't get drawn in, and the secretions are left overly thick.
In early childhood, pancreatic insufficiency is the most prominent effect of CF. This happens because the thick secretions jam up the pancreatic ducts, not allowing digestive enzymes to make it to the small intestine. Without the pancreatic enzymes, protein and fat aren't absorbed.
And over time, this can lead to poor weight gain and failure to thrive. Fat malabsorption can lead to steatorrhea. Eventually, the pancreas gets damaged because the backed up digestive enzymes degrade the cells lining the pancreatic ducts, causing local inflammation. This can lead to acute pancreatitis with repeated episodes, chronic pancreatitis, with the development of cysts and fibrosis, giving the disease its name. It's not until later in childhood that lung problems start to crop up. Normally, the cilia, these hair-like projections lining the airways, do a pretty good job of keeping them clean by moving mucus, which catches things like debris and bacteria toward the pharynx, called the mucociliary action. With thick mucus, though, it gets a lot harder to clear, and the mucociliary action becomes defective, which means bacteria is allowed to chronically colonize the lungs.
If the bacterial load suddenly increases, it causes symptoms like cough and fever, a decrease in lung function, and sometimes changes on a chest X-ray. This is called CF exacerbation. Over time, repeated CF exacerbation can ultimately lead to respiratory failure, the leading cause of death with CF.
In terms of treatment, a major goal is around nutrition and healthy weight gain. Fortunately, fat-soluble vitamins, extra calories, and replacement of pancreatic enzymes can all be supplemented. In terms of pulmonary treatment, there's chest physiotherapy, which loosens the mucus by literally banging on the chest. This physiotherapy also includes inhalers. There are also medications that cleaves disulfide bonds in the mucous glycoproteins, or medications that is a nuclease which cuts up nucleic acids in the mucus to thin it out. CF lung disease is obstructive, so pulmonary function tests are regularly used to monitor the disease. For a quick recap,
Cystic fibrosis is an autosomal recessive disorder involving the CFTR gene, which most noticeably causes issues with the lungs and pancreas, but can also affect other organs. Cystic Fibrosis by Kyla and David.